Okay, it's working.
Are we all set then, Deanna?
Just 1 second, it's redirecting and we should be live. Okay, we are live.
We're all set? Okay. So now I would, Wendy, can go ahead and start the meeting then.
Are we going to do the roll call?
Yeah, oh, I'm sorry, that's correct. Deanna, can you go through a roll call first, please?
Sure can. We have, I'm just gonna go in the order that it's on the screen here. I have Dr. Elder.
Oh, you want me to say I'm here?
Sure, thank you. Wendy Carey,
Here.
Dr. Newton,
Here.
Eric is in the office. Is there anybody else with you?
Yes, Sean, Aaron, and Roseanne are here with me.
Thank you. I have Alex Stepanski,
Here.
Dr. Edwards,
Aye.
Dr. Myers,
Present.
Katie Mungary,
Here.
Marla Velke-Rieger,
I'm here.
Dr. Barr,
Here.
and is there anybody that I forgot?
So John isn't here yet?
Not yet. I don't see him.
So go ahead and start, Wendy, if you'd
Okay.
like.
Sure. We'll call the meeting to order. We have a quorum. So we'll take a look at last month's minutes.
Make the motion to approve the minutes.
Do we have a second?
I would second.
Any discussion? If not, all in favor?
Aye.
Any opposed? Okay, so moved. Audit of claims. Sean, do you have anything for us?
Yes, good evening, everyone. As you can see from the report that was sent out, the expenses for this month are down considerably, obviously due to inactivity from COVID-19, as well as the fact that this month's board meeting is quite a bit early due to the Memorial Day holiday. The largest decrease in expenses is in the preschool program due to having 0 transportation costs this month, and due to the early meeting, we did not receive some of the agency's tuition bills for the month of April. They'll be processed next month, so I expect to see expenses go back up some next month as the providers catch up with their invoices. But overall, it's a very, very low month for us.
And was tuition adjusted at all because of the COVID stuff for the agencies?
No, they're eligible to receive full tuition.
You mean whether the kids go or not?
Yes.
Oh. Can I ask about there was an ambulance? Is that somebody getting to or from school?
The ambulance service covers our after hours on call. That's who does our on call after hours.
On call.
Taking our phone calls after hours and
Oh.
routing to our on call person.
And the food, is that for in March?
That was for while we were dealing with the pandemic, a couple times a week providing food for employees while they're working through their lunches.
Good.
It looks like you gave them some Tylenol too. Okay, yeah.
That was for a patient.
Oh.
Any other questions for Sean? Do we have a motion to approve the audit of claims?
I'll move.
A second?
Second. Rachel. Done.
All in favor?
Aye.
Aye.
Any opposed? So that's carried. All right, we're moving on to the COVID-19 update.
Okay, I'll start with some of the numbers, go over those first. As of this afternoon around 4 o'clock, we had tested a total of 2,692 individuals. Of those, 292 have tested positive. That is up 1 from yesterday. We have 2,336 individuals who tested negative. We have 64 test results pending. We've had 33 people who have recovered. We have 8 deaths total. We have 99 people who are currently on mandatory quarantine, and we have had 506 people who have completed quarantine. Of the individuals, the workers that were tested from the greenhouse that were in the hotels, 97% of them have recovered. Our focus right now in terms of where we are starting recovery last Friday, we're focusing on testing and contact tracing. In terms of contact tracing, the metric from the state requires us to have at least 21 people contact tracing. We currently have 28. Of those, 20 are staff members, and then the other 8 are volunteers. In terms of testing, this week, we expect testing numbers to go up significantly as our home care, or not our home care, but our nursing home will be our testing. I know that Kraus tested today, and we had at least 129 tests completed just at their office today. So our numbers are going to go up significantly. We also have Walmart providing testing on site, the one in Oneida, beginning on Friday. We are working out some final arrangements with Upstate Medical for the use of a mobile testing vehicle, which I believe Thursday and Friday of this week, I need to get confirmation on the times and dates, but I believe Thursday and Friday this week, they will be, on Thursday, I think they'll be in Wampsville, and on Friday, I believe they'll be down near Morrisville State College campus. So we have a lot of testing that's going to be done this week, so our numbers should go up significantly at that point. One of the challenges that we're facing in terms of the testing is that just getting the message out to the general public. There's been a lot of changes recently, both in reopening, but just the messaging on who can get tested, that seems to be changing every other day. So we're trying to make sure that the criteria, they still have to meet certain criteria to be tested, but one of the new criteria is that if they're part of the businesses that are allowed to open up in phase 1, then they can be tested. That was the latest thing that we heard. So we're trying to get some more confirmation on that. We're also trying to identify, trying to get ahead of things, identify our vulnerable populations in our community. In addition to nursing homes, we have several senior living housing or apartments. We're trying to identify, we've identified those. We've identified the number of people that have lived in they're living there. And we're trying to secure the test kits so that we can do some, be a little bit more proactive and progressive and get some more testing done, especially among more vulnerable populations. So we're looking at that, and we're looking at the process by which we would do that testing as well. So,
Are you talking, I'm sorry, Eric, are you talking about getting your own rapid testing in, or just getting testing them with the viral media?
yes, with the viral media, no rapid
so that's
test.
not the test. You're not doing the test. You're just collecting. Okay.
Well, yeah, I'm sorry, I probably used the wrong term. We're swabbing. We want to swab people, and then we'll submit it to the labs for testing. So
Okay.
we're working out the details on that now in terms of trying to identify both staffing as well as PPE and swabbing resources. But that's what we've been working on for the last few days so that we can do some of that stuff as well. So I don't know if there's any other, if you have any other questions
So,
That's-
so it sounds like the testing and the tracing is done for the work site, the greenhouse, and the hotels or the living situations.
Right, we still, I think, and Katie can correct me if we're wrong, I'm wrong, but I believe we still have, people coming in that may work there for testing, or we're still getting some of those. But for the most part, that work at the hotels, like I said, 97% of the people that were positive have recovered. We still have a number of people in quarantine at both of those places. Let me just check here. I think we still have about 30 people in quarantine from the hotels. So, but in terms of testing, we are picking up some of those individuals for testing, but at this point, we're kind of moved beyond that now.
And the nursing facilities, who is doing that testing? Is the state sending in people, or is Madison County got people?
The state is requiring the nursing homes to
Do it themselves?
well, if they can, or make arrangements. And so we have the extended care facility at Oneida Health. They're testing their own individuals with their own staff. We also have Kraus. I'm not sure how they coordinated the testing. I know they previously they were able to test with their own in-house staff. So I believe that's what they might be doing as well. Or they might be coordinating with Community Memorial Hospital. They told us they did the test today. They didn't say who they were using to get the test, but we haven't, I think Grand was trying to coordinate some testing either with Upstate or, remember, that's just for the staff, it's not for the residents. So the staff could really go anywhere they want to get tested at any of the sites in our region. But that's been left up to the nursing homes to determine how their testing is going to be done.
And I thought that ultimately the residents of those places were going to be tested too.
They have been. I know that Oneida Healthcare about 2 weeks ago tested all their residents and all their staff with the extended care facility, and they had they had no positives. Everyone came back negative. So as the governor has emphasized in this initiative, it's testing of staff,
Right.
not testing of residents. So that's where the focus. I mean, these, I believe you would have to speak to the individual nursing homes, but I believe that they have been testing staff as if they met criteria for testing, if warranted.
Right, that's usually the way it is.
We did have some people at the Grand that tested positive, so there was some testing of the residents.
And is Walmart going to be open to the public? Yeah,
it's going to be appointment only, and
Okay.
and again, it has to meet the criteria.
So it is
testing.
criteria based. That's what I wondered. Thank you.
Yep,
So-
all testing is still.
I don't believe you have to meet the requirements at Syracuse Community Center.
No, you can get testing
Anybody-
there.
when
Anyone
they-
can get tested.
Anyone can get tested, yeah.
So we're still, the biggest is, so it sounds to me like the biggest issue that we're still facing, like everybody else, is tests.
Well, that's where the emphasis is right now, and so that's where all the
There aren't
focus.
enough of them. Is that correct?
I'm sorry, I didn't hear that.
There aren't enough of them?
Aren't enough tests or the kits for testing?
Yeah.
My understanding that I believe today, the nursing homes or the adult care facilities actually receive the kits from the state directly shipped to them. We're trying to get exact numbers from them as to how much were sent to them, but they were directly sent to the adult care and nursing homes.
Right, because they're struggling, I think, still on the state level to get the tests they need. So, okay, thank you.
So
Yeah.
there's two, I guess sometimes this gets me confused, but you're talking about the swabs and the viral media versus the
Correct.
actual tests. So there's supply chain problems with both, but I think people are sending, I mean, they limited Wadsworth now, at least for us, to only inpatients. They won't do any outpatients, but for
I
the
believe this, yeah, the governor in his announcement today, we learned today that they had identified, I want to say about 7 labs. I don't have them in front of me. There was labs identified to help with the nursing home testing, that the nursing homes could use for testing. So they've designated some of those labs for that. I don't have the list because it was just on a slide from the governor's presentation this morning, but that's something we can get a hold of and get out to you guys. Right. So, but the kits, the swab kits have been sent to. Yeah,
sorry,
I
in the
know.
lab, we call them kits. It's test kits for us. It's the actual tests, but it's the swabs
Right.
and media for that. So.
Right. The materials to collect the samples have been sent to the adult homes and nursing homes. I understand the labs run the tests, but the materials for the collection have been sent to the nursing homes. So they have those, or should have those.
Well, the governor said
question-
there are plenty of tests. He said there are plenty of tests out there. So I don't know where. I mean,
Well, he said there's plenty of capacity. And that's kind of another side to this. They put these metrics into place for how many people per, 100,000 need to be tested. And he's indicated that we have the capacity for this testing. Part of the challenge is people aren't getting tested. I'll give you an example for today. The 2 hospitals reported they conducted 4 tests. And 2 of these people were non-Madison County residents, so they wouldn't count for us. People are just not getting tested. So part of what we'll be doing this week as well is be pushing out messaging to encourage people to get tested. And it's important they get tested. That's part of the whole effort to get people back to work and to reopen up is getting people tested. So hopefully we'll encourage people to do that.
so Eric, did you also say though, we're a region, not just the county, because they don't care if you come from Madison County to get tested in Syracuse. Doesn't that count for the region or
Yeah,
is it still?
the metrics apply to the region, not individual counties, although they will give you individual county numbers. But as the governor mentioned on his presentation today, he doesn't take, not to focus on county specific numbers, it's a regional number. And I think our number for the region is about 750 we have to do on a daily basis. And we're averaging about 1,000 right now. So as a region, so testing, and it's only going to go up because now the nursing homes this week are pretty much the nursing homes are going to be doing the testing. So I would expect the numbers to go up dramatically in terms of the number of people tested. So my focus is less on the testing and mostly making sure we don't have increase in hospitalizations as a result of opening up.
Eric, this is Marla. I apologize for interrupting. So just to clarify, so because the Walmart site is going to be a site where you would have to meet criteria for testing, I mean, is there a place in Madison County where we could be sending people that just, I'm a well person today and I just want to be tested? Or is that all that we would send them all to Onondaga at this point?
Well, that's a policy of that center to test whoever. That's not necessarily, there's no site in Madison County that's just going to test anybody.
Right, that's what I'm asking. Yeah.
Even the mobile unit that we'll bring in here,
Yeah.
they're going to have to meet criteria. Now the criteria, like I said, got loosened up a little bit. Any
Okay.
essential workers can get tested, and then any individual that's part of those businesses that opened up in phase 1.
Yeah.
Are now eligible. So they did expand the criteria. It's just not
Okay.
open to anybody at this point.
Okay.
Eric?
And if Syracuse is doing that, that's a policy. That's not a county decision. That was a policy decision by that particular site, that location.
Eric? Excuse me, Eric?
Yes.
With these people returning to work to be tested, are there certain hours at these testing sites? And would it conflict with their going back to work?
It's possible. I would have to direct, I know Sam,
And if the hours were only during the daytime and that's when they're working, they wouldn't be able to get back and get those tests. I don't
understand
know.
that.
Okay.
I understand that. I don't, I know, I believe Sam posted the sites along with the hours, but that would be a question more for Sam. I don't have that answer.
So back to Marla's question, is there a reason not to do one site for everybody, or you want to get numbers? That's why they opened it up, I believe, to anybody. So you have so many people tested.
Like I said, we're looking into that. We're trying to come up with, first of all, is who's going to do it? Where are the resources, the staffing going to come to do that? Because right now, our sites that are testing. We don't have the nurses, and so we have to look for those resources. That's part of the process.
Didn't the state just say pharmacy could do them? Pharmacists, non-trained?
Pharmacies, yes. Pharmacies are allowed to do them, but we have no pharmacy. We've been surveying the pharmacies, and only the pharmacy that is expressed interest is Kinney's, and we're still waiting to hear back from them as to when and if they're going to do it. But no other pharmacy has indicated to us through our survey that they're interested in doing it.
I gotta think that's gonna be a logistical nightmare for them to try and do that.
Right.
But
And I believe there's also, I believe they can bill for these swabbing collections as well. So, but I think you have to meet criteria for that to occur. So I think that's part of the challenge. And I believe also if you've been tested once and your insurance covered it, I don't believe you can get covered for a second time. So that's going to be a challenge as well. But right now, like I said, if the two hospitals we surveyed them for capacity, they can do approximately 140. We're doing their capacity, and we're only getting 4 people showing up. So it's not a capacity issue right now. And I think the governor indicated that in his press conference. People need to go get tested. They're just not getting tested. Part of the challenge is the criteria may be too narrow at this point. But that's something that the state has to loosen up. That's nothing that we can bypass.
right, and it's confusing, I think, because it's been changing and people have been turned away for testing because they didn't meet criteria. And now that it's loosening up, I don't think people, including professionals in the community, understand who and where the testing can be done. And
right. And if you recall, when with the more strict criteria, at least initially, unless they met that criteria, people were just telling them to stay home anyhow. Because even if you got tested and were positive, if you weren't sick enough to go to the hospital, you're just going to end up staying at home. So I'm sure people, the general public, saw that. It's like, well, what's the point of getting tested? I'm just going to end up staying home anyhow. So I think we have all this, this weeks of all these different changes in messaging, and we're trying to we have to filter through that and kind of get out to that's why I said messaging is going to be extremely important, because what exactly is it? What is the current message that we need to get out there right now, given all the changes that have occurred over time? So that is a challenge. The messaging has been one of the largest challenges in this whole thing, is getting accurate information out.
right.
Well, I'm not sure accurate it's just the new, it just changes. In the past, if you wanted to get COVID testing, you had to be isolated until the results came back, or quarantined until they came back. So now if you go down to Syracuse, you don't have to be quarantined yourself.
Well, that's if you're an essential worker, you don't have to be symptomatic or in order to get tested, as long as you're an essential worker. So, that's changed as well.
So if the hospital, if you got tested, and you were essential worker, you could not come in though until you got the results, if you thought you needed to get tested. So that was because there was a, why were you getting tested? You must have been exposed.
I'm not sure I understand that question.
No.
Well, I'm saying that there are a lot of changing things, all the different things about this test. Before, if you needed to get tested, you would have been not being able to come in until you got the results.
You mean just anybody?
Yeah, at one point earlier, when the criteria was strict,
Right.
you had to wait until the test results were back before you could proceed.
Right.
So it's not, it's just more the current. What's the current to keep up with all the changes?
Well, like I said, that criteria expanded for essential workers and those new businesses that are allowed to, as part of the reopening, they can now be tested. But that's the only expansion in the criteria from the symptomatic and so forth that was earlier. So those are the only changes. I think that's part of the challenge is if we really want to get more people tested, those criteria have to expand beyond what they are now. That's they're kind of, it's one new addition at a, every other day type of thing. So that's part of the challenge. It changes every other day. And so just when we get a message out there as to this is the criteria, it changes, and then we have to come back out again. So I can, if I'm the general public, I got to be confused by now after all this stuff. And so, like I said, our biggest challenge has been the messaging. Like as soon as we get something out, something changes. So that's been one of the hardest things for us. So yeah, we understand that, and we'll do everything we can to help facilitate that. But part of the challenge, realize, is that the lab, for example, like the 7 labs, or I don't know if it's 7, but the labs that are going to be designated for nursing home testing, that was announced at a press conference by the governor. There was no pre-notification of the counties about any of this. So we learn about changes at the governor's press conference like everybody else, and then we get all the calls to understand how that's supposed to be implemented. That's one of the hugest challenges we have.
Eric, I just have one more question. This is Marla again. I just wondered, is there, and I think you alluded to this, I'm just not clear. So if, like, I have patients who are asking, about testing and things like that, where is there, like, on our website, is there a list of where they can go in Madison County or where they could go within our region in Onondaga County?
There is a regional, there is a map of the web, or there is something of the web on the website of the locations for testing. And I believe it's regional. I haven't looked at it, but I believe that's, it is. It's on the county's website.
Okay.
However, you could also inform those individuals that they should contact their provider. Always go through their provider anyhow, because their provider may be able, because one of the criteria is at the discretion of the clinical provider. So if their provider thinks that they warrant testing, all that other criteria, that can supersede all that other criteria. So I would always have them go through their provider first and get guidance there, and if there's nothing they can do there, they may want to think about these other sites.
Okay, thank you.
I did check with the our health insurance person. I'm not the insurance person, but the Health Alliance. She does not believe that you would get tested, even charged, even if you got tested more than once. She says there's not supposed to be a charge. So I guess that would be interesting to clarify too. People are worried they're asymptomatic and don't want to get tested because what if I become symptomatic?
Right. Yep. That would be good if that's true. I hope. Yeah.
Any other updates?
Not on COVID, no.
I guess I hesitate to say this, but if you were going to give a clear message today, it would be to encourage essential and the newly opening business people to be tested. And that would not mean that they are limited from work while the test was coming back.
True.
That I would have to follow up on to get clarification, because like you said, traditionally, if people were tested, we would ask them to self-quarantine until the results came back. You know, one of the other aspects. One of the other aspects, so, I mean, we do ask people, and I believe providers are telling their people if they're coming in to get tested, they need to self-quarantine until they get their test results. I don't think that changes. But let me clarify that, because those, like I said, those new expansions and criteria introduce a whole nother set of questions, such as that one, as to whether or not we need to do that. So we'll get clarification on that.
Wouldn't that make sense that you don't have to if you're doing it, not because you
Right.
came in contact with somebody, but because you want to make sure you're not positive before you
Yes.
go in?
And you have no symptoms.
You have no symptoms.
Right, I agree with you, but we don't have any guidance from the state on that, so we'll need to follow up on that.
I think there's also the question that some people have talked about. They don't want to be tested because they've been dying to open up their business and they're afraid they have to shut back down again if they come up positive.
Which is not good for the community.
That's not what we want.
That's right. That's not the philosophy, but I don't know how many people. I've heard that from a couple different people. So I just wonder how widespread that thought is. And that might be part of the non-testing issue.
I can imagine that being true. Dr. Enders, was that you that posed the question? It sounded like you.
Yes, that was me. Yes.
Just want to make sure.
So any other COVID questions?
So about the masks, and I know you've gone through this, but people are still supposed to be wearing masks outside if they can't social distance, and in stores, and
They're supposed to be wearing face coverings. I think they've gone away from calling everything a mask.
face cover.
Correct. And I believe that's been extended by executive order to June 7th.
Well, it'd be nice if the stores enforced it. Yesterday, I was at Price Chopper at 8:30 in the morning, and there were 3 individuals without masks.
Right. I mean, the stores where they have employees interacting with the public are required to wear masks, but the stores are not required to require their patrons to wear masks. Some stores do, some stores do not.
Yeah, and I think there's angst about that as well, because I've heard some business owners say that they almost wish that the state would say you have to put up a sign saying you need to wear a mask coming in because of the conflict it puts them in, and it's down to the individual business, and I think a lot of them would look forward to getting support to say, we want people to wear a mask to come in because it protects us as well.
Well, it's the same concept as putting a sign in the window that says no shirt, no shoes, no service.
Right.
You could say
Yeah, that would be nice.
We need a catchy slogan that rhymes with face covering.
Yeah.
I mean, I think the businesses can do that. They don't necessarily need something from the state, but it helps definitely.
So you're saying that they don't have to wear a mask going into a store? I didn't understand that. I thought they did.
No, the people
There's
in the
nothing that
store
says,
have to-
there's nothing that says about going into the store. What it says is that businesses where the employees interact with the public, those business employees have to wear a face covering. For the general public, you have to wear a face covering wherever you cannot social distance. So in many instances, in a store would put you in a situation where you're supposed to wear a mask, but there's no enforcement, there's no requirement for them to wear a mask. You can go into a store, if you're the only one in there, then you don't need to necessarily wear the mask, do you? I mean,
Yeah, yeah, you're
a lot of
spitting on everything.
well, okay. That's part of the challenge, was trying to interpret the state's guidance.
Well, I'm like, Jared, can't we support that somehow the business owners put those signs? Or Wendy, I mean, how does that work?
We have done that, Rachel. We have, in fact, if you recall, several weeks ago, I was actually on the media and encouraged store owners not to let people in without a mask. We've had some places ask for signs, which we've sent to them.
The Price Chopper.
The Price Chopper in Hamilton has those signs in a very prominent place at the entryway, to the point where you can't even see through the entry doors because those signs are so prominent. And I would say for the most part, the last few weeks, everyone I've seen is wearing a mask, not always appropriately, and sometimes touching their face. Sometimes it's underneath the nose. But I would say both. The only places I've been were Price Chopper and Tractor Supply the last couple of months, other than my office. And it's gotten much better in terms of people getting that message, at least in this part of the county.
Yeah, this is my first encounter with this, and I'm hoping that people are not misinterpreting the opening up as meaning, okay, I can take my mask off and don't need to wear it.
We are hearing that as well. I think we've had some comments, not necessarily directed to our health department, but I believe that there was some concern that people were saying, because we reopened, that masks are no longer. That's why the county is going to be sending out messaging this week about face coverings and what reopening means, type of thing. So that, to reiterate, that was why we wanted to get clarification, making sure that the face coverings, because the initial executive order said the face coverings, that order ceased on May 15th. So they issued another executive order, I can't remember the exact number, but that extended it to June 7th. So we're trying to get the message back out there that just because we've opened doesn't mean you shouldn't be wearing a mask. Or face covering, you still need to be wearing a face covering. So
that would be a good idea.
So that is what's happening this week in our messaging.
Okay, good.
Any more information on the PEDS inflammatory syndrome in the state?
We do have an upcoming call with the state health department where we're supposed to learn more about that. So I'll be able to give you more information after that.
Great.
I did sit in on a call with intensive care doctors from 4 of the New York City hospitals last week. Did you have specific questions, Jerry, or just asking about the statistics around here?
Well, I'm just trying to understand if it's growing. I mean, at one point I saw 2 and then I saw 64. So is it growing? Is it quick, or is it stabilized? And are there any new ideas about treatment or?
Yeah, so it sounds like for the most part, it's a post-infectious syndrome. So most people have positive antibodies, and a few of them have the positive viral swabs. It sounds like kids tend to shed virus longer than adults anyway, but it sounds like it's following the peak of illness. There definitely are still expanding cases. It sounded like the ICU doctors that were speaking had their pediatric ICUs were half full of adult ICU patients who had been offloaded onto peds, and half full of these systemic inflammatory syndrome. It sounds like it's mostly hitting kids between 5 and 18 to 21 years of age. They're all having very high fevers. About 95% had some GI involvement, non-specifically. 2/3 had eye inflammation, 2/3 had mucosal changes in their mouth. Most of them went very quickly into a shock-like picture, which is obviously frightening for all of us who have been saying that children are mostly mildly affected. The numbers are still small when you look at the grand scheme of the number of adults that have been hospitalized, the number of adults that are on ventilators, but there's been, interestingly, almost no lung involvement unless they've been fluid overloaded because of the cardiac involvement. There have been a handful of cases in Europe as well, but all of the New York Children's Hospitals seem to be seeing at least a few cases. But it sounded like the grand total as of the last I saw was around 200 worldwide. So still very small numbers, but
Right.
in many cases, they were completely healthy children previous to becoming ill, which is different from the adults where it's affecting healthy people, but more affecting people with underlying medical conditions.
Right.
And in terms of treatment, they're trying most of your Kawasaki treatment. So a lot of them have tried IVIG, some had tried anakinra. I know early on we were suggesting not using steroids in COVID patients, but this is a case where a lot of them are getting systemic steroids for blood pressure support as well as for anti-inflammatory effect. And then a number of different immune modulators, IL-6 antagonists, things like that. They're trying really hard to create some clinical protocols out of thin air, but they're trying to model them on treatment of Kawasaki or toxic shock syndrome, since there's definitely parallels. So that was as of last Thursday.
Thanks, that's helpful.
Sam, where are we at with dental openings? Have you gotten any more guidance there?
No, I really haven't. I mean, my understanding is that it's probably going to be phase 2. I know that there's a fair amount of political push from the dental organizations to have it be phase 2. The guidance in terms of enhanced infection control is thin, to say the least. I got my new fogger to be able to fog the rooms in between patients with hydrous chloride. And that's been great fun to play with. But really nothing much substantial to report.
And in our county, is there any place for emergency dental that you know of?
Most offices are taking care of their own emergency, at least the ones that the people that I've been talking to, I've been taking care of my own. The large practice in Oneida has been seeing their own emergency patients. I believe that Dr. Barry down in Hamilton is taking care of emergencies. We're not restricted against taking care of emergencies. Some offices I know have shut down totally. But I haven't, there's still an obligation to take care of your patients and make appropriate referrals if you're not able to take care of them yourself. So I don't think that's too much of an issue. I think a greater issue is that as time goes on, small problems start turning into emergencies, and we'll see more and more of that as time goes on.
Yeah, I've seen a few patients who needed care and weren't getting response from their provider. So there are some people who are doing some of the dental surgeons, I guess, they'll take a patient that's not theirs, But that's the problem, having people who don't have someone get to a place where they'll be treated.
Well, they really should, an office really should make arrangements, otherwise it's
I agree, but
it's
I don't,
abandonment.
yeah.
I did hear one of the family practice people say that the dentist had been sending in patients to ask to get them COVID tested recently at the one of the medical staff meetings. I don't know if you've gotten any requests like that. Or Sam, would you do that? I mean, it seems like that's a logical way to go, to have them tested, but
I think if we lived in a world where somebody could come in for COVID testing and then you knew 15 minutes or a half hour later that whether or not they were positive, that would be a reasonable thing to do, you know, in an emergent type situation. But if it's an emergent situation to send in a test and then have to wait 3 or 4 days,
oh no, I'm
and
thinking
then
of,
wonder whether.
oh yeah, I'm thinking elective
No, go ahead.
because they're not testing COVID patients on the non-elective, but on the elective cases, they're testing them for
But
surgery.
they're required by the state to do that.
Right, but I don't think that's a bad idea. Do you?
I don't know about that negative, and then you wait 3 or 4 days or whatever that length of time is to get the result.
Hmm.
You don't really know what their status is at that point in time. I think it's more appropriate to just assume that, just like when the whole AIDS thing started, you assumed everybody had AIDS and you treated it the same way. And, you know, that's what I'm comfortable with, frankly.
I guess the only other question I have, I know it's tiring, but the mental health, it seems like people are becoming more stressed, and I wonder if there's anything developing to try and help. I know a lot of people now are doing telemedicine, which is really great. And hopefully some places will be opening up, but in the county, is there any place? Contacts is still working.
Right, and the county has its own mental health department separate from us, so they would be a better one to speak to in terms of services. I believe they do have like a hotline on our website for mental health needs. I do know our mental health department is doing a lot of teletherapy, or they're doing it that way, and that's actually been going quite successful. I do anticipate, you know, we're at that point in this event too, where I also have rising concerns about the other health issues. We've been focused on COVID-19, and rightfully so, but with this isolation and quarantine and the closing down, as you said, that we're starting to see a public that's growing. There's a lot of concerns in terms of not only behavioral health issues, but other issues such as suicide, increased drug use, potentially domestic violence. Some of the things that we probably haven't heard of or heard about because everything's so focused on COVID-19, but I also have other health concerns to where they may become more of an issue than the COVID-19 at some point if we continue to stay closed and, you know, shut down. So I expect those things to increase and come to light once people start coming back out into the open, if you will.
Jerry, Madison County Mental Health does have a 24-hour crisis line. And I just got word yesterday not yesterday, I apologize, Friday, that they, their mobile crisis unit is gotten the green light to be able to be dispatched for crisis cases again. So I think many of us have moved to telehealth, obviously, because insurance has also loosened the restrictions. So in some cases, while I think we are headed into a crisis regarding mental health, I think there is, in some cases, people are enjoying this level of accessibility. And I know for some people around the county where traveling to Wampsville has been prohibitive in the past, this has actually been, easier that they've opened this door, so to speak, to now offer this access. And Eric, I believe you alluded to this last week that, they may continue to offer this in some capacity after, some of the COVID restrictions are lifted, because it's working for some folks in the most rural parts of the county.
Right, and I think this will actually expand even more. So, one of the issues that's kind of prohibited the telehealth initiative to occur here has been the broadband capacity. But I think that's also going to be addressed to where this, the telemedicine is going to be a big change in how we do things, after this is over. So you're right, though. I believe you'll see ongoing telepsych or telebehavioral health after this is over, and it'll continue.
Okay, anything else on COVID? Alex, do you have anything for the county?
Just that the county plan for opening up county government is in a recent press release that's available on the public health website. It's pretty well laid out as to some sequences. Some things will be opening to the public. Most things will still only be on appointment basis. But anyway, it's on there you can read the whole thing. It was on the last press release that I read. That's all I have.
Okay, thanks, Alex. Eric, do you have something else?
No, COVID-19 is pretty much what we focus on right now.
Understandably so. Wendy, do you have anything for us?
No, nothing tonight.
Okay, thank you. Dr. Newton?
No, sir. No other updates.
Okay, thank you. I don't have anything to report tonight either. Any old business? New business?
Can I ask about the cooling towers and the failure or something? In the
environmental report.
Yeah.
What is your question?
What's your question specifically?
What failed, and where are the cooling? What are the cooling towers? Where it said they failed.
Well, they fail. If you don't do sampling on time, they're non-compliant. They're not in failure. It's a compliant.
Oh, are you there?
I am.
Oh, okay.
This is in regard to those facilities that have to test for Legionella in the cooling towers. And so, as Aaron said, this is more of a failure to sample.
Okay, so
failure.
you didn't get Legionella. It didn't get tested.
Yeah, it didn't get tested, or with the cooling season opening up, they may have put in that their opening date was April 1st, but they didn't turn on their cooling towers. That's why the numbers are a little bit lower than what we normally expect. So while the registry says they're open, they're not actually open yet. So.
Okay. And
It'll be more clear next month.
What's that?
So we'll have a clearer picture of that next month as we get more information.
And was there a dog with rabies?
No, a raccoon. Dog was sent in.
I'm sorry, the dog?
Dog was sent in for testing, but it was negative. The raccoon was positive.
And I saw the rabies clinics have been suspended, but you're going to restart them maybe?
Yeah, our next one's June 13th at Wampsville, so,
We play that by ear in terms of whether or not we hold it or not. We cancel it. We wait to see what's going on, and then we decide whether or not to hold that one. So we're doing it one at a time. But we
John,
haven't scheduled. We do have to do, the state requires us to do 3, and we still have plenty of time to do 3. It's just that, as you know, with COVID-19, things change daily. So as we get closer to the date, we'll make a decision whether or not to host it. And then we may have to decide how to do this, because normally we just have people line up with their animals. So we may have to figure out how to do it differently as well, which we've been giving some thought to.
I was just, Dr. Enders, have you had issues with, I mean, it seems like trying to get dogs in, we had to sit out there in the car, just like, I guess, all the offices.
Yeah, we pretty much run our operations with more curbside sort of things as well, with exchanging of animals in our foyer, clients wearing masks when they come up to make the exchange. So we've been able to keep some services going, but yes, it's a whole different change of protocols and how we handle things. But all the critical things we've been able to handle okay. And that should also be opening up a little bit more as people feel more comfortable to do things. However, I think there's still going to be a lot of the curbside only type service. I guess like everybody else, it's acquiring of the PPE and everything else and the time to disinfect and trying to figure out how to handle clients inside the hospital. So we've been very limited about how things have been handled. But so far, so good. That staff has stayed healthy.
That's good.
Any other new business? I guess our next meeting will be June 22nd. And right now, we don't know if we're going to attempt to have a meeting anyplace or still keep online.
I think we'll keep it like this for now, online. Seems to be working out all well. Again, we'll play that by ear, but right now we'll continue to do it this way.
That seems the most logical way to do it.
Right. And we've had a great attendance too, so it's working.
Okay, if there's nothing else, can I have a motion for approval to end the meeting?
I'll move.
I'll second it.
All in favor?
Aye.
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 Okay, meeting adjourned. Thank
Okay.
you, Eric. Thank you.
Right.
Thank you, everybody.
Thank you.
Thank you.
Thank
Have a good night.
Thank you. County at Wampsville, thanks.